So we have Dr. Virendra Agrawal from Jaipur, a very high volume cataract and refractive surgeon, talking to us about life begins at 33 centimeters. Is your PCOL ready?
Thank you, Dr. Ramamurthy, for giving the kind introduction, and I must thank AIOC for giving this opportunity to speak on the topic. I don't have any financial interest in the topic and talk, but I do use this lens a lot, and I prefer this lens is a lens of my choice, giving away that everybody who can afford, I use this lens. I will just take one of your minute for attention. Just take out your mobile and try to read any SMS. You all can do at what distance you are going to read, and that is the reason of my talk. There was a lot of burden things. People used to say that the intermediate distance is the in thing. I think it is not the in thing, particular for the India. The near vision means it has to be less than 40 centimeter, preferably between 30 to 35 centimeters. There are some people, because of the short arm length in India, are requiring even lesser. So the thing is changed, and that is the reason that I was using multifocal lenses since 1996. Initial lenses were having an addition of +4 diopter. My patients were very, very happy, except the thing they need to keep it close and at a very fixed point. And that fixed point was a big problem. Then the different lenses came from the same company or the other companies, from bringing to 4 diopter 8 to around 3, 3.25, 2.5, and all trials were done. And they were giving better results in sense because they were keeping slightly away, and the thought was given to the patient itself also. They try to keep it at a slightly distance thing. But now, as you see all, that our life has changed from initially from the print to the computers, laptop, or iPads, tabs, and now mobile. But now I think everything has come down to mobile. You don't require most of the time the newspapers, you don't require TV, you don't require desktops, you don't require these iPads. What all you do that you carry with your hand, and that mobile is giving everything to you. We were using the multifocals, trifocals, but they were all having some gap, and that gap was an issue because there are many people who were in habits of keeping it here or there. So you can't choose and decide that which patient will actually require at what distance. And there are times when you may know it, but they wanted more freedom. And that is why we were looking for a lens in which there is a continuous zone or continuous range is available. And luckily now we have a lens which is with the name of Technic Synergy. I don't have any financial interest in that, again I repeat, but I am using this lens a lot. And I feel out of the lenses available today, particularly for the multifocality, this is the lens of choice. There is a word going on for EDOF also, like without rings, but I still feel the without ring lenses are not giving that crisp vision as the lenses with the rings are giving. So the patient, if can be convinced and are ready to bear with the some of the night vision issues, my lens of choice is these kind of lenses. Why continuity is required? I'm going to share my personal experience. Whenever I used to do multifocal lenses, the next day or after some time, I used to say that you have to learn how to read. It is a new lens, new optical system. You were having some of the habits. You have to unlearn them and learn how to use it. So the technique was either ask them to hold a paper here and keep it going away, or bring it here. Keep it here and bring it near to the eye and find a sweet spot where they can read well. That was working well, but not for everyone. And it was not accepted by everyone that why should I need to change? You should have informed me before that I will require to change in my learning habits, reading habits, but still it was going on. And I was looking for a lens in which it can be done. Another trick, the personal experience I am sharing, I am having 4 lights in all directions. Depending on the requirement, how the patient is going to read, I used to make switch number 1, 2, 3, 4 are my codes. So my number 1 light is behind the patient. So whenever I used to give multifocal lens, I am keeping it off because I am sitting in front, so it gives the disturbance to me. So I keep it off, but whenever somebody comes that I am not very happy, So I say give him newspaper and number 1. So number 1 code goes for the staff to start the number 1 light, and patient starts reading and he is happy. But that is a kind of cheating. The same thing I applied with the synergy lens. Then what happened? They said, and he noticed it. He said, Doctor Sahab, you are doing cheating. So now it is challenge to me what to do. So I asked my staff to off. He did it, patient was still happy. Then I become more bold. Then I asked to switch off 2, 3, and only 1 light was left. So I asked him, should I keep it on or should I keep it off? So he said, I am happy. So that gave me a confidence that this lens can actually work in any light. So another issue which was in discussion previously and may come in the now, that different lenses reduces the contrast, they require extra light. So you need a lens which gives you a freedom for holding your gadget or reading material at a distance. The another thing comes that it should require extra light or not extra light. And third thing comes, now the things are changing from a normal light to LED lights. So for these all, this lens is having different features. So there you can see the MTF of this curve in which different lenses for comparison, no negative for any lens. I used all lenses and may use again some of other lenses in the same way. But trifocality, multifocality or continuous range of vision is under discussion, and in my choice, blending the two technology of multifocal and extended range of vision from the Symphony, they have come out with a good lens and with the advantage of chromatic aberration correction. This chromatic aberration correction gives extra focus in the sense of depth as well as blocking the violet light which is usually emitted from the LED lights. They have taken out a lens in which most of the visual phenomena of light conditions are actually removed. So because of this, my happiness with the patient has really increased, and I am really happy and confident to implant them in VIPs. The last talk in the last session, they was commenting that the multifocality for mainly for females and EDOF mainly for males. This was the time when I started almost in 1996 to up to 2005. I was implanting mainly females. No gender bias, no disrespect to them. But because it was a people believing that putting them in females who are not driving. But now it is equal gender, everybody is driving, and not the age. Even the people who are in 70s are also driving. But believe me, the patients, if informed beforehand that you will have rings around the headlights of the vehicle on the road, majority are well tolerant. Not tolerant, well tolerant. They don't complain. I rarely see a patient who comes and tell me, because of this, you go for explantation. Till date, I have not done, and I used more than 1,000 synergy lenses in my individual practice. So my choice is that you should do this. But be a word of caution that you should not implant in everyone. You need to have a dry eye evaluation. You need to have proper topography, appropriate biometry, and a constant setting. SIA should be done. I have different testimonials. I will not go for it. But I implanted in surgeons. I implanted in the patients who have undergone LASIK if the topography post-surgery is good enough. My take-home message is that you all should first believe that this technology is going to work, does not have the problems as it is being hyped by colleagues or because of the past lenses. Now the time has come when everybody wants freedom from glasses, and if you treat him, if you give freedom, it will add on your practice. Thank you very much for your kind attention.
Thank you so much, Dr. Virendra, for giving a comprehensive overview of a lens which is worldwide used.